Good morning and welcome back to JP, Kathy, and the crew here on 1160 AM, KBDT News Talk Sports. News, analysis, commentary, and debate. Don't miss the Wells Report with John David Wells this afternoon from 2 to 5, only on 1160 AM, KBDT News Talk Sports. We're looking at a high of 76 today, a low of 61, and here at 8:34, we've got 73 degrees in the Dallas-Fort Worth area, and we are so happy that you have chosen to spend your morning with us. Of course, the majority of us had a nice 3-day weekend. Again, I hope everybody had a chance to honor those who paid the ultimate sacrifice for us this Memorial Day. We get to do what we're doing right now, which is a very important segment of our show and one of our greatest sources of pride here at JP, Kathy, and the crew, and that is our mental health moment. And we're super excited because pretty soon we're going to have Congressman Taylor joining us during our mental health moment. Currently, we've got Patty Giolot of the Something for Kelly Foundation and Steve Dunn of the Morgan Foundation. How are the two of you doing today? And we can't wait to see you back in studio.
Back in studio and see your bright face. That'd be very nice. Hoping it can come soon.
Yes, very much so. So let's talk about the importance of mental health right now. The congressman is currently getting ready to call in. What is so important about the month of May?
Well, it's a focus on mental health. So what we're trying to do during the month of May is to have people who are particularly well-suited, and the mental health moment really is excited to wind up the month with Congressman because legislation is such an important aspect of what we can do to accomplish the next step.
Kathy, good morning. And I also believe it's incredibly important because we are already seeing an incredible spike in mental health issues right now. The anxiety, depression, fear, stress are all just spiking out of control. And just as we had such concern that the medical system could not take the load on the medical issues rising, we know for a fact that the mental health care system we have right now is woefully inadequate to help everyone with all of the rising claims, of course.
Well, and I think it is, again, it's so important that we talk about how important it is. Mental health has always been an important issue, but pushing forward now with COVID-19 and with all of the things we're dealing with that.
Absolutely. Kathy, what we're also seeing as well, I think the mental health industry right now, we need to find a way to pivot things and present all of this information to Congress in a new way. For example, we know right now there are 555 bills that are pending in which COVID-19 is part of the bill. Of those 555 bills, only 2 pertain to mental health. Just 2. And that is just, that is proof that it's just woefully inadequate right now. We've got to be more proactive in presenting mental health issues in a productive way so that people like our congressman can take proactive steps, and we basically have to help them help us.
Exactly.
And Kathy, there's a lot of medical professionals that say the next epidemic or the next pandemic is going to be mental health, and I advocate that that's not the right attitude. The attitude is it's here, it's on us right now.
Oh,
and if
absolutely.
you think that it's coming, you're really not on top of your game. It's not coming, it's here. It's really, we have to be proactive and be now in the game because this is not on the way. We're already dealing with a rise in domestic violence. We're already dealing with a number of people who cannot handle the stressors, and substance abuse is on the rise. This is not on the way. It's here.
Well, and that's the thing. It is the here and now, and unfortunately it is. And if we don't, and I think one thing that has happened with COVID-19 is we have got We've gotten, hold on just a second, and I think we're having a little bit of technical issues with Congressman. If you'll try calling that number one more time, John David Wells, thank you so much, and we appreciate it while everybody bears with us while we get the Congressman on the phone. I think if we don't talk about this right now, that I don't know where we are, because you're right, domestic violence, spouse abuse, child abuse, everything's at an all-time high. I mean, my goodness, what was it? I don't know if y'all were tuned in the other day when we were talking about the fact that, obviously alcoholism's on the rise like never before, but they said that I think it's 38%, and somebody from the crew, correct me if I'm wrong on that, but 38% of the people are day drinking and drunk while at home, while working. That's a pretty high percentage. So I just, we've got to do something about that.
Absolutely, and unfortunately, I think it's only going to get a little bit worse before we see improvement. But Kathy, there's always hope, and the fact that we're able to talk so openly about it is, the first great sign. We're taking mental health out of the darkness and out of the closet and bringing it out into the light. And you've got to first admit that there is a problem, and then you have to start to talk about it in an intelligent way, and through people like you and JP who have helped so much. The talking aspect is coming out more and more, of course.
Right. Well, and again, that's why I think it's so important that y'all are doing this with us. And I'm so proud that we started this, back in September.
Yep. Yeah, not quite on a year yet, but it was.
Wow. I mean, we're coming up on a year. And so we appreciate y'all being with us and being ahead of the curve on this, because I think now more than ever, and again, even once all of the states open back up and everybody's back to normal and all that kind of good stuff, you're still going to be dealing with the ramifications of what COVID-19 and this pandemic and this shelter in place and this lockdown has done, because there are people who have lost their job, but maybe they're tapped into their savings right now, or they're getting some kind of help from the government, but that's not going to last forever. And with that being said, we need to be looking forward to how do we help those people when that runs out, because it's impacting people now, and it will be in the future. And then we've got Congressman Van Taylor on the line. Sorry, that was my fault, because I fat-fingered and typed in the wrong area code for you. So thank you, Congressman, for hanging in there with us. That was me. I've got new glasses coming this week, so...
No, you're totally good. And good morning.
There you go. I love it. Well, we've got Patty and Steve on the line. So let's go right into the discussion with Congressman Van Taylor. And again, Congressman Taylor, we appreciate you being a member of, being a part of the crew and a part of our radio station. And you talk about a myriad of items with us. I don't know that any of them are more important than the mental health and the mental well-being of our Americans.
Good morning, Congressman. Thank you. Thank you so much for joining us today. This is Patty, and we want to jump right into your background so that anybody who doesn't already have the privilege of knowing you can learn a little bit about your background and the seat that you won that was formerly held by Congressman Sam Johnson.
Sure.
Tell us about yourself, sir, a little bit, and how you got to where you are.
Sure. So I born in Texas and born actually in Dallas, and seventh-generation Texan, and joined the Marine Corps after college, and was in the Marine Reserves during business school, and then my Marine Reserve unit was activated in 2003, and I led the 1st platoon into Iraq for my brigade on D-Day, March 21st, 2003, and accomplished every mission, brought everybody home, married the girl that sent me a letter every day I was there, and we're raising 3 little girls. Was in business for 16 years. And during that time, I was in real estate finance and on a bank board, and served in the state legislature for 8 years, the state house for 4, and state senate for 4, and was elected to Congress in 2018 to represent Collin County, so represent most of Collin County in the U.S. House of Representatives, and I've been there for about a year and a half.
Thank you, Congressman. And I am also in Collin County, so I thank you for your service, both in Iraq and also for our country. We are very excited to have you here with us today. We're going to jump right into the mental health moment, and there's some mental health professionals that are referring to this as the next pandemic. Before you jumped on the line, I was advocating that it's really already here. How is our system equipped to handle this next pandemic of mental health that is coming right at us?
Sure. So I think it's important to understand that building a mental health care system in this country, and in particular in general in Collin County, has been a priority for a long time. In my time in the state legislature, worked with the county commissioners court, my fellow legislators, to create a mental health care authority for Collin County specifically. And so we have an indigent mental health care authority. We've had that for many years. It's done, and I've gotten really good remarks from that for many years on the job that it does. And there are, we have capacity, mental health care capacity, and we have mental health, whether it's hospital beds, whether it's a suicide prevention hotline. We have all kinds of different capacities inside Collin County and around the country to deal with this. And I think I think the important part of your question is, what is going to happen next? What is the go forward here? And that is that Congress is certainly thinking about that. All the headlines have been about the economic response, around the medical response, but Congress has appropriated funding for mental health care specific to this pandemic, and then I've worked on legislation in Congress prior to this pandemic on mental health care. So this is something that's important, and it's there. It's just not front and center because people are focused on first things first, but this is definitely something that was focused on, honestly, from the very beginning.
Congressman Steve Dunn here, and again, I echo everyone thanking you for appearing today. Congressman, it looks like, for the most part, understandably so, the Congress has emphasized the financial and medical aspects of COVID-19. I checked today, there are about 555 bills in Congress today that mention COVID-19, but only 2 pertain to mental health. What can we as mental health providers and advocates do to better convey to our congressman the importance of mental health? Because I think this falls on some of the failings of the mental health advocates. How can we better get to you the message that we need to give?
Sure. No, Steve, great question, and thank you for your service to our community and in the mental health care space. It's just so important. And probably it's really on me to convey to you what we've already done. So inside the CARES Act, it actually delivered $425 million for substance abuse and mental health care services, and as part of that, $250 million for certified community behavioral health clinics, and $50 million for suicide prevention programs. So already, from the beginning, the CARES Act was focused on, thought about, and funded. Now, again, the core of that act was trying to, you're putting the entire U.S. economy into an induced coma while you're trying to combat an epidemic, an international pandemic. So we have, but let me just assure you that it has been a priority of Congress in my year and a half in Congress. I've co-sponsored 4 different bills that dealt with mental health care. Mental health care, there was a bill dealing with trying to prevent child abuse, which increased funding for mental health care for children that had gone through that, improving Medicaid services for mental health care, and 2 different bills trying to help veterans either through the VA, trying to help their mental health. So that's something that I worked on last year before this pandemic. But this is unquestionably a priority and something that I think you're going to see Congress do more work on as we go forward, because it is such an important it is an important priority.
And Congressman, we'll be right back with more of Congressman Van Taylor during a special segment today with our mental health moment. Of course, we're very blessed here in the North Texas area to have somebody like Congressman Van Taylor who's fighting for our tax dollars, but fighting for our mental well-being and all things in between. We've also got Patty Giolot and Steve Dunn, and we're so proud that this moment, our mental health moment, is sponsored by Acadia Healthcare, and we will give that phone number when we get back if you need help. We'll actually put it on our feed as well. We're JP, Kathy, and the crew. We come to you live every Monday through Friday from 7 to 9 a.m. only on 1160 a.m. KBDT News Talk Sports. All right. Can y'all hear me? Can y'all hear me?
Right.
There we go. Okay.
All right.
And sorry, y'all, we're still on Facebook, obviously. So if y'all want to continue the conversation, and Steve and Patty, do y'all want to let Van know what you want to talk about when we come back from the break?
Absolutely. Congressman, when we come back, I know we don't have much time, so we try to give our listeners a sense of hope. Would love for you to address what Congress is doing. Really emphasize how Congress is looking at those mental health issues, and how do you see the mental health care for your constituents improving over the course of the next few years? Of course, would love to end on a note like that, if that's agreeable, of course.
Sure. No, and I think it's probably incumbent on me just to point out that there are mental health care resources available right now. I mean, there's no help out there. I mean, there are people like you that are serving the community every day, and then there are we have LifePath Systems, which is the Collin County Mental Health Authority provider. So we have facilities time now that are providing services for people, and so I think it's just important for people to know, hey, this hasn't just been forgotten and there's nothing there.
Right.
Quite the contrary, there's a lot there. And I think I walked through a hospital in Allen, and they said, we've got all these mental health care beds, and our big problem right now is we just don't have enough patients. I'm like, well, that's a problem or it's not, right? Depending on your perspective on that. And so, and I know another provider that they had a facility in Collin County, and they literally said, look, we just don't really have enough business. We're going to focus our efforts on places outside of Collin County where there's where there's not enough capacity. So there's no question that Collin County, we begin with something, and then there's no question this event is going to increase the need for mental health services.
Right.
And, over the weekend, I was talking to two district court judges, and they said that they were seeing, and I also talked to our sheriff in Collin County, and I talked to police chief last week, and so just the general sense for those conversations, if you kind of wrap them together, is overall crime down, right? So burglaries, assaults, sexual assaults, attempted murder, those are all down. But what is up is domestic violence, and what is disturbing is that your child abuse reporting is down, and I think I've got a problem, but I'm just not catching it. Is sort of the big concern that I have as a policymaker in Collin County. But that's there's going to be some mental health care needs that are a result of the stress that people are going through. As I talk to people who are who've not only lost their job, but are losing their home or losing their business as a result of the economic distress that this event has created.
Well, and then again, we're about to go back live here, but that's one of those things. There's always a mental health impact with the financial impact, and I'm glad that, Congressman, you recognize that, because unfortunately not everybody does. Okay. Good morning and welcome back to JP, Kathy, and the crew on 1160 AM, KBDT News Talk Sports. Again, we are so proud that we have our mental health moment every Tuesday at 8:34. Please share this segment. If you need help, contact Chris Getz at Acadia Healthcare. The number is 469-400-7499. Again, Chris Getz at Acadia. They sponsor our mental health moment, and we are so proud of the work they do. If you need help, please don't hesitate to call 469-400-7499. Of course, we've got Patty and Steve, who are always with us on Tuesday. Can't wait to have them back in studio with us. And then we're really excited because we've got Congressman Taylor, who usually calls in a little bit earlier on Tuesday, but he's part of our mental health moment and this so important discussion, because it takes people in the mental health care and the physical health care, the medical field, all of these people and these advocates helping. It also takes our government realizing the importance of this, and we're so blessed that here in North Texas we have a congressman like Congressman Taylor, who not only takes care of we the people with our taxpayer dollars, but he's also very protective of the fact that our mental health is extremely important. So thank you, Congressman. We appreciate that.
No, again, great to be on with you. And let me just add, as I was saying earlier, there are resources out there. Collin County has an indigent mental health care authority. It's been there for many years. It's done a really good job. And the CDC recommends for people that need mental health care help that they have a 1-800 number. I'll just give it to you right now. It's 800-985-5990. Or you can text Talk With Us to 66746, and this will help you to get the resources that you need in terms of finding the mental health care. So if you know someone that needs help, or if you need help, these are places that you can reach out. There are resources out there to help people, and that's a very important priority for me and other members of Congress. And I'll just share that in one of the very first Congress calls that the Republican members of Congress had discussing this, a member of Congress from Mobile, Alabama, spoke up and said, "Look, mental health care is going to be an issue." When my community went through the oil spill 10 years ago, we had a lot of residual effects around mental health, and so it's something you're going to have to think about on a national level, and that's something again that's guided us, and that's why we've appropriated almost $500 million in funding in the CARES Act for mental health, and why I think you're going to see Congress do more in that space as we successfully get out of this, as we reopen our economy, as things get better financially. I think we're going to have to really deal with the healthcare ramifications of what COVID-19 has meant to our country.
I think that's a very good point. Patty and Steve, do you have any other questions for the congressman, or any comments or anything that he can take back to D.C. when arguing in favor of making sure that people's mental health is taken care of, especially with everything COVID-19 related?
I do want to thank the congressman for what he shared with us just now, because I think it's very important that we know that the people who have already had some kind of statewide experience with this can share with it on a nationwide basis so that we can all benefit from it. So I do think that's very important for everybody to understand that people are not sitting idly on the sidelines. So thank you for sharing that.
Absolutely.
Congressman, and finally, for those people who want to get involved as a mental health advocate or want to reach out to you, first, how can people get in touch with you, and then what recommendations would you give to people who want to really invest themselves and to help the plight of others out there?
Sure. Well, look, I appreciate you asking that. And so, Steve, and by the way, just call me Van. I work for you, so anyway, the familiar is terrific. So I have a 100% meeting policy. I've always had a 100% meeting policy. I've continued to have a 100% meeting policy, although by Zoom or by phone. But I continue to meet with constituents. I call constituents literally every day. I was calling people over the weekend. People were nice enough to talk to me on the Memorial Day weekend. And if they're interested in getting in touch with my office, call 972-202-4150. That's my phone number here in Plano, Texas.
Fantastic. And as a matter of fact, Or fantastic, should I say? That's what JP and I like to say on Tuesdays. As a matter of fact, I know we've got some of your staff who are on our live Facebook feed, Congressman Taylor. So we're hoping somebody will jump on and put those numbers and the contact information in there, because Steve and Patty will take this segment and share this out separately from our show, and this goes out to a lot of people because we're trying to reach as many people as we can. Patty, Steve, and Congressman Taylor, thank y'all so much for being with us on this very important edition of the Mental Health Moment. Y'all stay healthy and safe and stay blessed, and we'll talk to you tomorrow on JP, Kathy, and the Crew here at 1160 a.m. KBBT. All right. Can I hear?
All right.
Thank y'all so much. That was fantastic. And Van, thank you for tuning in for a special segment. I think it really makes a strong statement to have a congressman on during a mental health moment. I think it makes a very strong statement, and you're going to be able to lead by example. So thank you.
Absolutely.
Thank you, Congressman. We greatly appreciate your participation.
All right, bye guys. All right, now I'm going to try to sign off on this, but I don't want to jack it up, so I'm going to back off and let John David Wells do this. Love you guys. Do I end live video? We'll see y'all tomorrow.
Go ahead and end the live video.
In live video.
Yes.
End. Okay.